Hi, I'm here with Kyle Hogan. Welcome to our 2021 DIA one-on-one program. Nice to see you, Kyle.
Nice to see you, Taryn.
So we are going to talk today about behavioral science. We're hearing a lot about it. What is the connection between this eCOA, patient engagement, and clinical trials at large?
Sure, that's a great question. When you think of behavioral science, what we're trying to get folks to start realizing and thinking about is that there are things in 2021 that we actually understand about motivation behind human behavior and about the kinds of things that make us feel more or less likely to engage with applications or tools that we have to use in our daily lives. And what we've done here at Datacubed is really build a solution around that understanding to deliver a less complicated experience for patients. A conversation I had recently with my CEO, Brett Klieger, he talked about the reason that he came over here was because he looked at the way the clinical trial is for patients today, and it's pretty bad. And the idea of doing something to make that better really resonated with him. And I think that's the case with most of us here at Datacubed, is we want to have an impact on that. And behavioral science really gives us a lens and a set of tools to do that, Taryn, in a way that can make the experience better and really kind of turn the process of being in a clinical trial from being burdensome and stressful and unpredictable to very comfortable, predictable, and something where we feel like we've got a little bit of help and a guide along the way. And that's sort of really what behavioral science is doing for us in the way we're leveraging it for how we bring patient engagement to bear or gamification and how patients are interacting with ePro and eCOA.
Kyle, that's wonderful. And that leads us into our next question set. Decentralized trials are all the rage today. Talk to me about how Datacube is investing and spearheading in this area of focus, and what do you see for the future in this space?
Well, I think if you think about so there's two sides to that, right? There's what are we doing to invest in the future? And they're a little similar in that where we're trying to invest is where we see it going. But really, if you think of what is a decentralized trial, to me, that seems to be the place to start, because there's a lot of ways people talk about it. To our mind, it is anything that you're doing to reduce the number of interactions or physical connections that a patient has to have between them and the site in person, meaning they have to physically go to that location. So we're not talking about eliminating the site. We're not talking about eliminating the clinician from the experience.
Right.
What we want to do is make that a less like a more of a frictionless experience. And so what that looks like is an environment where you set up options for patients to do things outside of the site that historically they've only been able to do at the site. So ePro, if you think of it as the start of that, being able to answer those questions at home, being able to do it in a digital way so that as a clinical trial, we know what's going on, we can monitor what's happening, and we have timestamps and so forth around that and confidence about what we're collecting. But what about the process of onboarding the patient or getting them into the trial in the first place? Their ability to, say, collect the information, for them to deliver data back and forth in the trial, but also for them to be enrolled in the first place. So one of the things that we've implemented here is a self-service enrollment model. So when you've identified a patient and you want to enroll them in the trial, they don't have to come into the site. They can go to a website, enter a code, download the application through either Google or Apple, because we're fully, set up for patients to use their own phones. Download the application and get into the trial and just get off and running without having to go to that site. But what about e-consent? Well, we've built that into the process as well, right? So once you download that application, you can be consented into the process and then begin doing your questionnaires. And because we're trying to figure out a way to keep these patients connected without having to go back and forth to the site, we build in a lot of that patient engagement to make the experience a little bit more comfortable. And then we gamify the whole process, meaning all of your interactions are fun, Taryn. You're not trying to go through what feels like a static piece of paper that's been little more than rendered to fit on a dynamic screen, but actually a dynamic experience. And then being able to do that in a fashion where, let's say, visit 4 and visit 8, right, can be done remote. Well, let's build that in there. So we've built in the virtual visit capability. So you can really do that between the patient and your sites and not have to have everything done in person. But what's more than that, you need to be able to be flexible. So when you've got a situation where visit 5 is coming up, you did visit 4 virtually, and nothing is happening at visit 5 that couldn't happen virtually, and you've got something going on where you're like, I just can't take the time to drive to the clinic, but I don't want to throw everything off in my study. Well, you simply respond. Let them know, let the site know that this is going to be a problem, and the site can change the visit, all in the system, do it all dynamically. And I think if you think about what we're trying to do, these are the areas we're focused in on, making it easier for the patient, making it so the patient can operate a little bit more independently, but also making sure that the solution is flexible to the needs of the patient at the time the patient needs it. And I think that's really going to be the future of what you think about for the decentralized trial, is that flexibility point. Think of, last year, there was lots of studies that were going on, which were highly disrupted by COVID-19. With this kind of flexibility, those disruptions, not really a disruption. And if you think about the future, we know that one of the things that's tough for patients in trials is predictability 3 months out is hard to provide. We have lives, we have jobs, we're students, we're parents, we're grandparents. We need to be able to flex to the needs of our lives, and the trial should flex with us. And I think that's a big part of what we're looking at.
Wonderful. And finally, Kyle, how are certain patient populations more impacted than others? Or are they when it comes to behavioral science-backed patient engagement? And how does that look?
So I think everybody is impacted by this, right? So that's the first thing I want to clarify, is that I really believe that when we consider who's impacted by bringing behavioral science into a patient engagement strategy or into a strategy for ePro and eCOA, it's everybody. But there are some populations where we're going to see significant improvements or significant impacts. So think specifically about a pediatric trial where, for instance, you've got multiple caregivers and you're trying to figure out how to keep them connected with your patient. They need to be able to enter information on behalf of a child if the child's too young, or even as the child's getting older, if there's some activity for the child and for the parent. But what's more than that, you need to be able to adapt a real strategy to the patient. So when I think about patient engagement for a standard patient population, it's very different, Taryn, than a patient population that's, say, 12 or under. And what we have the ability to do is create custom worlds and custom gamified experiences that really adapt to that population. So it becomes fun to them. Like they're going in and they're playing a game. Their avatar becomes part of who they are. They establish that connection with it. And similarly, and where I find a surprise to a lot of folks is, like the same in the pediatric population, we've actually seen data to support the same on the elderly population. In fact, a recent study we did showed that the elderly populations in our application spent more time customizing their avatars than any standard population. So they're in there trying to buy them new outfits, put them new glasses on, get them a pet, whatever. So I think, if you think of some of these populations where historically we think there may be a real problem or real challenges, they really start to make a difference and show you a lot there.
Kyle, that's wonderful. Thank you so much for sharing these great insights with us for our DIA 101 program. Thank you.
Thank you.